health, we do health. SMS MedShield to 33023 or talk to your broker to get your kind of care.
Are people happy with the way they look?
Yes, I am happy.
Why do people go to gym?
I just want to keep myself active and healthy.
No, it's just to keep myself busy.
Do people still believe in weight loss products?
No, I don't believe in them. I just want to lose weight naturally.
I do believe, but most of the time I prefer if you're using it and do the training also.
Well, talk about losing weight. Well, obesity rates in South Africa are increasing rapidly, with almost 70% of women and 40% of men either overweight or obese. Furthermore, reports show that 1 in 4 girls and 1 in 5 boys between the ages of 12 and 14 years are overweight or obese, while obesity-related diseases such as heart disease, type 2 diabetes, stroke, and some cancers account for 43% of deaths in South Africa. Obesity is one of the top 5 risk factors for early death. Now, National Obesity Week is celebrated from the 15th to the 19th of October and is commemorated to increase awareness about the impact of obesity in the lives of South Africans. So today we discuss obesity. Now we'll focus on all aspects of obesity, including the impact, causes and risk factors, whether or not it is cool to have this pot belly, prevention of obesity, the importance of knowing your numbers, treatment and support. Now, we're going to be joined in studio by the Chief Director of Health Promotion, Nutrition and Oral Health from the National Department of Health, an endocrinologist, the Director of Priceless South Africa at the Wits School of Public Health, and owner of FitPro. And via Skype, if we get it right, from the Netherlands, we're going to speak to the head of the PHHSI research program at the HSRs. Now, we invite you to please join us and be part of this show by asking the panel some questions or simply just sharing your views with us. And the number to call in that case is Johannesburg 714-6918 or 6919. You can also tweet us at SABC Health Talk and simply just interact with us on our Facebook page, SABC Health Talk. Now, we're going to go for a short break. When we come back, we invite you to sit back, relax, and learn from this bumper show ahead. I'm Dr. Sello Mutaung, and this is Health Talk.
At MedShield Medical Scheme, we don't just talk health, we do health.
It's so good, nothing else can replace just your slightest embrace. And if you only would be my own all the rest of my days, I will whisper this phrase, my darling, c'est si bon.
MedShield Medical Scheme doesn't just cover you when you're ill, we'll help you stay well.
Coming up this week on Trends Travel, we celebrate our beautiful heritage. Take a bite the Kasiwe at the Kota Festival in Soweto. Move to the beat all the way in Durban. So come travel with us this Sunday at 12 only on Trends Travel.
Here we are witnessing the beginning of the end of the apartheid system.
If you did a paternity test on our constitution, whose DNA would come up? Not Nelson Mandela, not F.W. de Klerk, Oliver Tambo.
With the highest obesity rates in sub-Saharan Africa and 10,000 new diabetes cases diagnosed every month, South Africa is experiencing a health crisis akin to the HIV epidemic. Lucky Nkosi, a 24-year-old pregnant and obese mother living in Alexandra Township, is living this crisis on a daily basis.
Okay, now that I'm just weighing 120, they told me that I must lose at least than that 20 because I was weighing 150, so I lost so much weight for the past 6 months. So since then, I have to lose another 20, at least maybe be 100.
At the heart of this crisis is the expense of healthy foods and the accessibility and affordability of sugary drinks and processed foods. For Lucky, this reality has threatened both her life and the life of her unborn child.
I'm going to have a heart disease, and it's going to be a little bit difficult for me in labors, during labor. So I may actually lose my life. So actually, you won't leave junk because it's the cheapest, like I said before. Everywhere you go, you see shops, fast food shops, you only get a plate for 15 rand, so I don't know so about other people, but I can say other people are struggling to lose weight actually.
Lucky is a part of the 70% of obese and overweight women in South Africa at risk of developing diabetes, heart disease, and even cancer. As obesity is a form of malnutrition, it puts pregnant women's babies at risk of various birth defects, including stunting and early onset diabetes.
So you see, my mother has sugar, high blood, and my granny, she also has sugar, diabetes. So my father got gout. So this is a family issue actually.
Shepherd Jamera, the manager of Mbopa Cafe in Alex, has seen the rising popularity of the kota, named after a quarter loaf of bread. Filled with polony, chips and cheese, this meal is both affordable and high in calories, making it a hit among the 100,000 plus population of Alex and South Africans generally. Shepherd says they sell at least 140 quarters a day.
The kota is so popular because it has been there time immemorial. It has become probably like a food culture. We are a shop within the community, a community that is an influx of population and that doesn't cook. So it becomes so accessible to us.
But he has a warning for his customers.
I would like to advise my customer that eating healthy is very important. Whether they take their quota, really they should also make sure that they buy a fruit somewhere else or they do some exercise and lessen the sugar levels. Buy the Coke Zero, the Coke What to lessen the level of sugar so that there won't be any obesity of some sort. We always encourage that to our customers.
People have to lose weight for their own goods actually. Since I am going to become a mother soon, so I have to lose weight also. I'm not doing it for anyone, I'm doing it for me and my kids so I can see my baby grow. I don't want to lose my babies, I don't want them to lose their mother since they're all I have, so I don't want them to lose me actually. So I can see their future.
So we have to tackle this problem. It's a crisis. It's been described as a crisis. Well, to help us learn more about what this obesity problem is, let me take this opportunity to welcome our two special guests. First up is Dr. Sindip Bana. Now, Dr. Bana is an endocrinologist and head of endocrinology at Chris Hani Baragwanath Hospital and also senior lecturer at the Wits University. Welcome to Health Talk, Dr. Bana.
Thank you for having me.
All right. And next to Dr. Bana, we have Professor Karen Hoffman, who's director of Priceless South Africa, which is priority cost-effective lessons for system strengthening, and she's based at the Wits School of Public Health. Welcome to Health Talk.
Thank you so much.
All right. First, let's start with you, Dr. Bana. Before we talk about whether or not this is a crisis or not, but what are we talking about? Just understand just make us understand what it is we're talking about. What is obesity?
So, obesity used to be mainly a cosmetic problem in the past.
Right.
But since then, it's become medicalized because obesity has consequences which we cannot afford.
Right.
Both from a health perspective and an economic perspective. So, obesity is what ends up causing diabetes, type 2 diabetes, contributes wholly towards hypertension, dyslipidemia, which is a cholesterol problem, and all of those are the primordial effects in terms of causing heart attack, stroke, kidney failure, and amputations.
All right, we're going to get there to say, you know, what sort of diseases are they associated with? Is it associated with? But people talk about overweight, obesity. Just help us understand what the
So from a
cutoff points
definition
are.
perspective, it's obviously excess weight.
Yeah.
And medically, we divide it into two ways. So you can either use a waist circumference as a criteria, and there's a criteria for males and females. And by and large, most of the world, in terms of males, any waist circumference above 94 centimeters is considered obese. And in Asian men, it's below 90. And for females, it's 80 centimeters. So that's when you're using waist as a marker. The funders and certainly the medical fraternity as well can use something called BMI, where they take weight and they put it in relation to height, and out comes a number. And a healthy number is to try and be below 23, ideally.
All right. Just help us understand again, for the sake of some of our viewers, what is BMI? How do you calculate your
body
own BMI?
mass index,
right?
And it's the patient's weight and divided by a factor which takes height into account. And you can, there's various tools on the net that you could plug in these figures to and work it out.
Right.
Any number that falls between 25 and 30 is considered overweight. Above 30 is obese. A healthy BMI would be anything between 19 and 23. So these have impacts. So once we have a BMI above 25 and you're sitting with status of overweight, it means we're sitting with problems in the future. We're sitting with certain metabolic issues that are going to be coming up, which is what I alluded to earlier.
Right.
Okay.
Okay. So it's not correct for people to be fixed on the scale, because people tend to talk about, I was weighing 72 kgs, now I weigh 78 kgs. You can't look at it in isolation.
No, just as a number. I mean, I think if you want to look at a number, ideally, physiologically, most humans are at a peak health between the ages of 16 and 18, what we call the reproductive age.
Right.
And so if you wanted to compare a fixed number, you'd probably want to try and aspire to that number. So if, for instance, if I was at age 18 weighing 65 kilograms, then that would be my ideal physiological weight. It becomes a difficult number for people to play with. That is why the medical fraternity stuck onto something that's a bit easier, and the actuaries out there for medical purposes and pharmacoeconomics purposes look at a fixed number, and so that's waist circumference, or we're sitting with a BMI.
You've already touched on some of the, obviously the main question is, why should we worry about it in terms of, diseases that are associated with this problem. But in my introduction, I mentioned some figures, and people talk about 70% of our population, at least our female population, being obese. Do we have the correct stats?
Yes. So, whilst we can spend a lot of time debating whether this is accurate, are we in the top 3, are we in the top 5, are we in top 10, you don't want to be anywhere in the top 100. And that's the point. And so at this point in time, you're right about those figures. I mean, we're sitting with shocking figures. And like the Americans, over 60% of our population is now overweight or obese. And the problem seems to be bigger with our female counterparts. So certainly from studies in Cape Town, they've shown in Western Cape, we've got horrendous figures. But like I said, we don't have to be fixated about a number. All we need to know now is that we are sitting with an epidemic. And for the first time in mankind's history, we're sitting with more obese people and overweight people in the world than the thin, malnourished. So we've tipped the scales.
Let's invite a comment from Prof. Hoffman. Now, do we have a crisis?
I think we have a crisis. We actually have a tsunami. Okay, and I just want to agree with Dr. Sandeep, because what's happening here is it's not just the numbers, but it's the rate of change. Okay, so it's gone, it's really like this. It's not even just carrying on growing, it's growing like this. And that is the biggest problem, the numbers. And I think, just to add on, the complications of these diseases, kidney failure, blindness, amputations, The amputations, the wards of the hospitals of South Africa are filled with people who need amputations. This is now these obesity-related conditions, including, as the doctor mentioned, cancer. Okay, about 50% of cancers are related to obesity. Okay, this has to be stopped. It's now more that these conditions are more than HIV in South Africa, and sadly, we are the center of the HIV epidemic, as everybody knows.
But is it a problem that's peculiar to South Africa? I mean, how do we compare to the rest of the world?
No, it's a worldwide problem.
Right.
So certainly, it used to be a first world problem, and now the epidemic seems to be worse in developing countries. So by 2025, 2030, we're looking at about a 50% excess in terms of the number of patients we're going to have with type 2 diabetes. And behind type 2 diabetes is the obesity. And like you mentioned, you know, worldwide it's an issue.
But it's a bit of a paradox, isn't it? That we're saying that obesity goes hand in hand with malnutrition. I mean, you have poor countries where there's lots of malnutrition.
So what's happening?
How is that possible?
Yes, so it is possible. And as we saw at the beginning of this program, the problem is the marketing of foods that are very unhealthy and very cheap. Chief amongst them are sugary beverages. Okay, sugary beverages are very cheap. Okay, and they are what people think of as cool. Okay, not just cold, as in cold, but cool, as in the idea. And people are buying those, drinking them. 330 ml sugary beverage, 8 teaspoons of sugar.
All right, we're going to have to take a quick break. When we come back, we'll continue our discussion on this very, very important subject, obesity. Please stay with us.
If we're talking health, then let's talk seriously.
It's so good, nothing else can replace just your slightest embrace. And if you only would be my own for the rest of my days, I will whisper this phrase, my darling, c'est bon.
MedShield, embracing our members in good health since 1968.
Welcome back. We're talking obesity, and with my two guests here, Dr. Sandeep Bana, an endocrinologist, head of endocrinology at Chris Hani Baragwanath Hospital and also at Wits University, and of course, Prof. Karen Hoffman, director of Priceless South Africa. We were talking just now about, obviously, why is it that we're having this problem of obesity even in poor communities? Let's just take our discussion from there.
So the fact is that the beverage companies have marketed specifically, and they are saying they are targeting sub-Saharan Africa as a growth market, and they are targeting the poor in particular. They have stated that publicly.
Oh, a very interesting one. Let's take a caller in the meantime. We have Mbongeni on the line from Soweto. Mbongeni, welcome to Health Talk.
Hello, how are you?
We're good. How are you, sir?
I'm good. I wanted to ask a question from our specialist, the endocrinologist.
Yeah.
Is it possible that a person gets fat naturally because of their hormones, the way they were born, not because of their lifestyle, because of the food that they eat, and because they don't exercise? Is it possible that you get fat naturally?
Great
because of
question.
your hormones, maybe?
Thank you so much, Mbongeni, for asking the question. Excellent question.
Great question.
Incidentally, I was going to ask
Yes.
you the same question to say, what are the risk factors? Genetic factors?
So, Bongani, look, majority of the causes in terms of weight gain are lifestyle. It's what we eat and what we do from an activity perspective. But you're right, there are certain genetic factors and there are certain endocrine causes. So we know certain kids are born with a genetic condition. I'll give you an example like Prader-Willi. These kids will be obese and they've got a metabolic problem. There's certain conditions, endocrine conditions like having an underactive thyroid or a condition called Cushing's, problems with growth hormone. So whilst they are there, and that's primarily my job, where we need to go and look for these, as part of this epidemic that we're talking about, those would be the rarer causes. So they would account for less than 1% of the causes. But they certainly are there. And certain things will cause an increase in risk factors. So we spoke about genetic conditions, but there's certain things inherent in our environment that is also contributing towards the obesity rate. So
somebody asked the question once, sorry, just before we leave the genetic, I know it's not quite genetic, but I mean it's related. Pregnancy. Some people have said that women who gain a lot of weight, or they themselves worry that, you know, when they gain too much weight during pregnancy and the babies are born overweight, and that fat cells stay permanent and they're going to get fat into adulthood. Your comments on that? So
certainly, they've shown that women that tend to put on too much weight, so traditionally 8 to 12 kilograms for the average female during a pregnancy, anything in excess of that is speaking towards probably an endocrine problem. Be it polycystic ovarian syndrome, be it insulin resistance, be it a thyroid issue. And especially if they struggle to lose the weight. So we know that there is something called metabolic memory, and these mums that have put on a lot of weight, certainly the next generation is at risk of all the cardiovascular risk factors. So not only the weight issue, but diabetes, hypertension, and a stroke as well.
You wanted to give a comment, Prof?
I just wanted to say that this is a serious issue in South Africa. Many women are becoming pregnant, are already overweight before they even become pregnant, because of the obesity epidemic, and those people are at very high risk for what's called gestational pregnancy-related diabetes, and the children are then also at risk, both of being very large when they're born, but also of stillbirths. So it's this is a very serious issue of people who go into pregnancy who are already overweight.
So what's the prognosis of a baby that's born overweight? Can that baby into adulthood, I mean, you know,
there are
live a
problems.
normal life?
You alluded to it earlier. I mean, you know, 1 in 4 females below the ages of 18 and 1 in 5 boys below the age of 18 in this country are already sitting being overweight or obese. And they certainly do have risk factors, not only in terms of in the infancy phase where there's stunting of growth, but from a metabolic perspective, there's a lot of risk. Just to highlight it a bit in terms of numbers. So I've been at BERA for now 23 years. And when I used to do the gestational clinic with Prof. Huddle, on a Tuesday afternoon, we used to see about 15 patients who were diabetic and pregnant. The clinic at the moment runs at 60 to 80 every Tuesday. And that's just the epidemic that we're facing. So these mums are sicker. They require more medical care. There's higher risks, both associated with the mum and child, in terms of hypertension, preeclampsia, requiring higher Caesar
So lots
rates.
of problems. Before I give you a chance, let's take Lizette on the line from the Western Cape. Lizette, welcome to Health Talk.
Yeah.
Hello, Lizette.
Hello, Lizette speaking.
Yeah. Yes, your question or comment, please.
Okay, my question is, okay, I suffer from, I want to say suffer cardiovascular diseases and metabolic conditions, but I want to know, I struggle to lose weight, with the sense, especially with fat. Is it safe to use a fat burner?
Okay.
A fat burner tablet.
Excellent question. Thank you so much for that question. I'd like us to park that.
Okay.
Because when we start talking about treatment, I'd like us to address these issues about supplements
Practical
and fat burners and all of that. Yeah. You wanted to comment on what we were talking about earlier. Okay, it's fine. We'll come back to it. But Let's come back to those lifestyle issues, I would imagine, which is around our levels of activity and perhaps largely what we eat. What is wrong with what we eat? You mentioned sugar as one of it.
We've changed the way we eat.
Yeah.
As the saying goes, if it's not something your great-grandmother would recognize as food or drink, don't eat it. So over time, the way that food is produced, we eat a lot of processed foods, foods that are really basically chemicals, very high energy, dense foods that are very high in calories. Some of them contain some protein. The one that has absolutely no nutritional value and is marketed from morning till night, sugary drinks. Many people ask about how to lose weight. It's very hard. Once you've got through adolescence, puberty, it's difficult. If you've been overweight until you're adolescent, it's not that you can't, but it's very difficult. The one thing that you can do, because you don't need it, you want it, is to get rid of the sugary drinks. That includes fizzy drinks, cold drinks, fruit juices. Okay, people somehow think fruit juices are healthy. They are sometimes less healthy even than the fizzy drinks, and the energy drinks are even less healthy.
Let's talk about some of the foods that we have in our country that some people will say these are staple foods. Pap is one of them. Anything wrong with pap?
So, you know, if you look at, the Prof mentioned sugar, so let's park that one. We all know that's a problem. But if you look at foods generally, it's about balance. It's about getting the glycemic load to be balanced. So there's good proteins, and certainly you can spoil it by frying it. There's good fats, and certainly there's bad ones as well, saturated fats. And then there's carbs, which is where our pap would fit in. And so the foods become a lot more processed. Pap on its own is going to be high GI, depending on whether it's cold or warm. So it's about knowing how to combine these foods to make them healthier, and obviously getting the portions right. So traditionally, I mean, if you look at a plate, a quarter of the plate's meant to be having protein, about a fist amount. A quarter of it should be sitting with carbs, preferably low GI carbs. And I call it a cheat day, where one day in a week you can have your high GI carbs, but the rest of the time low or intermediate. And half your plate was supposed to be filled with vegetables, fruit.
I want to ask you a question around the price in that, you know, priceless South Africa. Can we afford healthy food? But before that, let's take Anonymous on the line. Anonymous, welcome.
Hi, how are you?
Good, how are you?
Good. Yes, my question is, I did call you a while back from Durban in connection with my back. At the age of 18, I weighed 105 pounds. I'm 63 now. I weigh 74 kilos. But then I went and saw a dietitian, and she told me I'm obese. But I've had a vaginal hysterectomy, which blew my stomach up. I'm very particular about what I eat, and I don't eat bread in a hurry. I eat health rice, and I eat health pasta. So what do we eat?
There's a question.
All right, so I think, again, like we spoke about that healthy plate, it's about a balance between the right amount of proteins, fats that are not saturated, and obviously having a lot of fruit and vegetables over there. Now, look, it's about mathematics. It's the amount of calories going in and the amount you're burning. And certainly, lifestyle and volume of food plays a big role in there. We know there's certain factors.
Can I ask you to just put a comma there? Because I'd like us to come back. I just want to give you the last 30 seconds to talk about, can we afford
healthy foods. There are 19 or 20 items that are exempt from VAT in South Africa that are all healthy foods that are needed. And it's just a matter of choosing the right foods, and those foods are often not promoted in the same way as the unhealthy foods.
And I'm sure we have examples of what those foods are.
Yes.
All right, we're going to come into that perhaps in our next segment, but Prof. Karen Hoffman, well, thank you so much for your time. Well, folks, we're just time again for a quick commercial break. When we come back, we'll continue our discussion on prevention of obesity. Please stay with us.
MedShield Medical Scheme, we don't just talk health, we do health.
It's so good, nothing else can replace just your slightest embrace. And if you only would be my own for the rest of my days, I will whisper this phrase, my darling, c'est bon.
MedShield Medical Scheme doesn't just cover you when you're ill, we'll help you stay well.
Hello and a warm welcome to PM News, and we're broadcasting live from Johannesburg.
4 decades later, the family is still seeking closure.
We need the truth, and the truth must be told.
Children often go undiagnosed because they are hidden away. About 1 million people in South Africa live with autism.
Creative recycling at play.
Mosaic has been around forever. I just had to find a new, fresh way to put and a new spin to put on it. So I decided, why not recycled cans?
Stay tuned to PM News for all your news updates every Saturday and Sunday from 1500 hours.
Welcome back, and thank you so much for staying with us. If you've just joined us, we're talking obesity, and with me in our studio, the gentleman in the middle, Dr. Sandeep Bana, endocrinologist from Chris Hani Baragwanath Hospital and Wits University. And we're now joined by 2 other special guests. First up, Lynn Moeng Mahlangu, who's Chief Director, Health Promotion, Nutrition and Oral Health from the National Department of Health. Welcome to Health Talk.
Thank you.
Right.
Thank you for having me.
And then, of course, we're joined by Derek Archer. Derek is owner of a company or organization or academy called FitPro, and he'll tell us more about that. Welcome to Health Talk, Derek.
Thank you for having me.
Right. We started talking obviously about the impact and all of the issues about what causes obesity, and I think it's time now to move to the more important aspect, to say, how do we prevent people from getting obese in the first place? And later on, of course, we're going to talk about how we treat them. But perhaps let me start with you. You've heard the discussion that we've had so far, and we spoke about pregnancy, women struggling with, gaining weight over pregnancy, and babies that are born obese. What are we doing as the Department of Health to try and address this problem, starting right from the baby upwards?
I think I need to explain that globally, there's more interest in now the prevention of childhood obesity.
Right.
Because we understand that children who are obese, they stay to be obese adults, most of them. Now, the issue is about the early feeding first. We need to focus on that. How do we feed our children in the first few years of life? Starting from your breastfeeding, we know the impact of formula feeding in children. You can either be underweight or overweight. If you are formula fed, if you are not giving the right advice and not preparing the formula well. Now, we are, as a department, we are promoting breastfeeding, starting from the exclusive breastfeeding, which is just be giving breast milk in the first 6 months, and continue with appropriate complementary feeding. Now, the challenge there is that most parents, what we introduce to children, we are already introducing sugary foods. We add a lot of sugar, we add a lot of fat in the baby's diet. By the time they are 2 years old, they are already overweight. And I think there's a cultural aspect which we also need to understand, because we think that fat is beautiful. You're having a nice plumpy baby, that's a well baby. But I think we need to move away from that, and that needs to be addressed with more education in terms of what is appropriate for children. And that, for me, is the first issue. Now we go to our ECD centers, which is our crashes and schools, where already children are introduced to sugary beverages. Karen already said a lot about sugary beverages. I will not touch a lot on that. Our children are introduced to that. Our children are introduced to all sweets that are sold in our own tuck shops.
Exactly.
That's an important environment that needs to be addressed. But there's also a knowledge issue. I think people do not understand how much energy they are taking in the food that they are eating.
Okay. Maybe just on that, let's take Petronella on the line from the Western Cape. Petronella, welcome to Health Talk.
Hi. My question to you is that, does it depend on how fast your metabolism is? Because my cousin is very petite and she has a small body, but she eats a lot and she eats a lot of junk food.
Right.
But she never gains the weight.
Okay.
So does it matter that how fast your metabolism is, that you burn, how quickly you burn your energy?
Great question.
And other people who don't have fast metabolism that eat a lot and pick up weight quickly.
Great. Thank you so much for that question. Dr. Barnum?
Yeah, so from the little that I got of the question, it's about
why is it some people that are thin can eat as much as they like, but others can't?
Look, genetics play an important role, and level of activity plays an important role as well. So what one person may think is being active is not the other person's level of activity. For example, our exercise physiologist will talk about something called non-exercise thermogenesis. It's picking things up from the floor, being active, jumping around. That's going to be active.
Let's give them the opportunity. First of all, Derek, tell us about what FitPro is.
Okay, FitPro is a tertiary education body. We certify fitness professionals for the industry, from personal trainers to group fitness trainers, and then provide programs to upskill them based on demands of the market, medical demands perhaps, also health demands, but in terms of trends and that we see globally.
Okay.
We also run the Exercise and Medicine South Africa courses for fitness professionals, which is an American College of Sports Medicine initiative, global initiative on trying to get people more active to deal with chronic illness like obesity, high blood pressure.
So talk about getting people to be active now. General public there, we're talking about how to prevent obesity.
Okay, well,
how can people get active?
Okay, activity, the word active is possibly the best choice as opposed to exercise, because as soon as you say exercise to someone, they think immediately of a gym and a weight environment, something where they may not be comfortable, or the cover model that they will never be. Activity is key. We're not active enough, and a minimum activity of about 30 minutes of moderate activity every day, 5 times a week, is enough to bring about changes in your health levels. So we know that it helps normalize insulin levels, reduce blood pressure or hypertension, and it definitely has effect on obesity. However, that's the minimum. In terms of achieving weight loss and so on, we need to take that activity level much higher.
Well, let's talk about that. People will say, I'm sure anybody watching this program, at least some of the people watching this program will say, listen, I work very hard. I wake up very early in the morning. I just don't have time for exercise. I have to wake up, catch a taxi and whatever, get to work, come back late. I don't have time for exercise. How do you advise somebody like that?
If I may.
Yeah.
Most important, what people don't, we all work very hard and we have a very hectic life. At the end of the day, you've got to step away and say, what is the quality of my life? Am I dependent on medicine? Am I going to live long? Am I going to be around to see my children turn 21 or get married? Or we look at quality of life over everything else. So if we're able to control those variables, or at least negate them through positive lifestyle choices, through activity, through correct eating and so on, we should hopefully be driven enough to improve our quality of life. Let that be the goal.
Yeah. You wanted to add?
Yeah, sometimes I think, certainly my patients feel they are active. So we did a study. One of my master's students did a study where we gave 100 patients in our type 2 clinic at Barra pedometers, and basically it measures the number of steps, and half was controlled and half wasn't controlled. So at the end of the first month, we found that the average number of steps in one half was around 3,000 and the other half was around 3,400, which is absolutely nothing. And these were patients that thought they were active enough for the diabetes and hypertension. Then we instructed the active arm to do 7,000 steps, and within 3 months they reached it, and it dropped HbA1c, which is a measure of how well the sugar is controlled, by 1 percentage point. That's more than a lot of oral agents are going to be able to do.
Perhaps you need to be a bit more practical and say, all right, because some of them may say, I can't count 7,000 steps.
No,
what
exactly.
are those simple things that they can do? But
I tell them 40 minutes of a brisk walk, and it's not going to happen tomorrow. So I tell them Start with a 5-minute walk over and above whatever else you're doing.
Yeah.
Increase it by a minute every day.
Yeah.
And within 6 to 7 weeks, you're fit enough to do a 40-minute brisk walk. Then we can start talking about all the other interesting
Perhaps
things.
you have other examples, but before that, sorry, let's take Lynn. Lynn from KZN. Lynn, welcome.
Welcome. Thank you very much for listening to me.
Right.
I'm 65 and I'm 102 kgs. Oh dear. Anyway, last week I went to the doctor because I had a chest infection and I was diagnosed with diabetes. I had 32. My sugar was 32. Yesterday it was 20, and I haven't been to the Diabetic Association. I'm going there tomorrow. But my question is, if I do the right things, lose weight, eat properly, would I have to go on to insulin?
Quick answer?
Quick answer is no. A Newcastle study showed 11 patients, only 11 volunteered, where they were put on a 3-month exercise program where they had to reach targets that you guys set. They had to go on a low-calorie diet, and all 11 came off insulin that were previously on. So that's not for everybody. But I want to inspire Lynn to say it can be done. It's about getting in there early, hit it hard, don't be sedentary, and that way you've got a chance of either managing it, which is first prize,
Right.
or even reversing it.
So it can be done.
It can
Unfortunately, we have to go for a quick commercial break. We're going to come back and continue this exciting discussion after a quick break. Please stay with us.
If we're talking health, then let's talk seriously.
It's so good, nothing else can replace just your slightest embrace. And if you only would be my own for the rest of my days, I will whisper this phrase, my darling, c'est bon.
MedShield, embracing our members in good health since 1968.
According to the survey conducted by the South African Medical Research Council, Statistics South Africa, and the Department of Health, by age 20, over half of women were already overweight, and by 45, this figure had rocketed to 82%. Queen Mukwena is one of many women who have been struggling with being overweight.
The way I was looking before and now it's different. But because of when I got pregnant, the firstborn I was thin, the secondborn, it's when I gained weight. Boo. So, you know, when you are so slender and become big, it's become a problem to your partner.
Like many, Mukwena has tried many products that promises quick weight loss results.
Linotrops and that Wohloza stuff. And Linotrops, it affects me a lot. I don't know what to say, to put in. I was feeling dizzy when I drink that Linotrops. And Wohloza, I only use maybe twice. Then I just left it because it destroys your body.
Although she struggled a lot with being overweight, Mokoena has never tried anything else except slimming mixtures and tablets.
I didn't try to go to the gym. I don't gym anyway because I'm a busy person.
She says that she has given up on the weight loss products.
The results of Wotloza will become scary because it destroys your body.
Mukwena's struggle with weight loss has seen her making healthy decisions for her young children.
The problem, the junk food. I don't know at school, but here at home, they eat healthy food.
So a lot of people are battling this obesity problem, and I'm here with my 3 special guests who are helping me tackle this problem, but I'm going to stay with Derek for a while. Derek, we're talking exercise now.
Yes.
We just saw somebody being at the gym.
Yes.
There was a question earlier around whether or not people that are already obese may feel a bit shy, to go to the gym, because when you go to the gym, you see these good-looking people that are slim and, are able to lift weights and so on. How can you attract everybody? How can we say, perhaps not just gyms, but exercise is for everybody?
Look, if you take exercise as what it's all about, it's actually supposed to be a way to improve your ability to meet the tasks of daily living. So if you are an accountant, for instance, and your task is to sit at the desk every day, we need to make sure that your cardiovascular training is sufficient to make up for your lack of movement during your work, that your core structure is strong, you're able to sit and maintain a good posture. But if that's, in terms of our exercise prescription, it would be dependent on any individual. So the idea would be to get as active as possible, as we've mentioned before. It doesn't necessarily have to be related to a gym. It can be walking around the block. There are plenty of walking groups, running groups and stuff that are very low cost and free. There's classes taking place at community halls and stuff around the country. We've been to plenty in Soweto and Alex. Yeah. But people need to not think of exercise as being fixed to a gym.
Right.
Obviously, for someone that is overweight, first thing, just to make sure that they go through a proper clearance procedure via the doctor, or get referred by a doctor or through a qualified trainer. But once they've been cleared to exercise, they choose a modality which they're comfortable with. Something where they're not going to choose an environment that is good for them, because it's got to be a positive state of mind as well. There has to be a positive outcome from that session. If they're feeling terrible, it's anxiety provoking, they're not going to be sustainable. And you cannot, we have to adopt an exercise regime that is sustainable, because you cannot defeat a chronic disease with a short-term solution like short exercise.
So people that are obese often, look for quick fix solutions. They will go to great lengths to try and get anything that will make them lose weight as quickly as possible. They will, just now we played a clip where they were talking about all sorts of stuff. I don't know what that Hotloza stuff is, but some drops, and somebody asked the question earlier about fat burners. What is out there? What should people be doing?
So, look, there's a lot out there, and there's unfortunately not a quick fix. And if there was a quick fix that worked without causing any major issues, then we'd know about it, because over 60% of the world's obese. The person would be a billionaire. And so all of these products that come in sit on the market for 3, 6 months, a year, and then they have to leave the market because there's problems, there's side effects. So we've had the Simply Slims of the world where patients had heart attacks. We've got this Chinese tea that's supposed to be FDA approved and completely natural, and it's found to have thyroid hormone in it. You go to the gyms and patients are on a cocktail of stuff that has a bit of thyroid hormone, a bit of a fat burner, a bit of a diuretic. None of these are safe. And so whilst you may get in a subgroup of users some weight loss, when they stop it, they're going to end up putting on more weight, because they didn't only lose fat, they lost muscle as well. And when they stop, it's easier to put on fat than muscle. And you'll find that they end up having more centimeters. So unfortunately, there isn't something that's going to be a quick fix out there. They all have complications. They all have side effects, palpitations, anxieties, blood pressure issues, excessive sweating, heart rate goes up. And that should already allude to you that there's an illegal hormone in this product.
All right. In some circles, obesity has some sort of stigma, and people are afraid to, get out there and, be part of communities and so on. How can these people be assisted?
I think the most important thing is for people to understand the risk factors associated with obesity, because that's one big challenge. The second aspect, it's for people to understand what is it that I'm doing wrong. And also understand that even though culturally we may think that being overweight or obese is acceptable, but in terms of your health as an individual, it is not good. So the education aspect and the understanding of what is it that I'm doing wrong. I mean, we say to people, start small. Identify what's wrong, remove one item from your diet that is not adding value. And there are a lot of those things. Beverages are one of those. They don't have one single nutrient in them, especially the SSBs. There is no nutrient in them. Remove those from your diet. Monitor and set yourself short-term targets. You don't have, when you're 120, don't aim for 70. You'll be discouraged. Tell yourself that I want to lose 10 at first. When you have reached that 10, it's exciting and you feel good. You want to go down a bit further. It feels good all the time. Any achievement is better. In fact, with any 10 kilo loss from whatever weight, you already feel much healthier. And that encourages one. So often we discourage people by saying your target weight is 65. When you are 120, you give up immediately saying it means I will never get there. So let me stay like this and I'm okay. So it's important that our education is very relevant and appropriate for that person. And some of the diets that we sort of give people are not achievable. Work on what a person has and modify that. So that's more sustainable than writing up a long list of a diet list of things that a person has to buy. Yeah. You need a new grocery list, which is different from what everybody else is eating at home. That is not achievable.
Yeah. Talk about eating at home. I mean, we spoke earlier about children and children going to school, being exposed to all sorts of things at the tuck shops, but some parents also pack stuff for their children.
Parents
Your
also,
advice?
Yes, parents also pack stuff from the parents. I need to. The issue of environment, changing the environment. It's firstly your home environment, in terms of how you prepare the food at home. It's the school environment. It's the workplace environment. So if you can change those three environments, at home, we tend to fry everything. We add sugar in everything. I mean, you know, WHO recommends that do not exceed 12 teaspoons of sugar a day as a man. Ideally, not 6. Do not exceed 6. But I'm talking about that 6 that you get from the little things that we do at home. Before you even take your can of cool drink, you have already covered your 6 teaspoons. So it's important for us to modify our own environment at home, and then the environment around us, which is your restaurants, your school, your crashes, and your workplace. And we are working on all those areas.
Okay. Derek, I need to be fair and give you a chance to comment on the supplements and what gyms often sell to people.
Okay, as we've discussed, there's definitely no quick fix to this. And as Dr. Van has said, you don't have, unless they've been approved and a lot of the supplements have been checked by pharmaceutical companies, you don't quite know what's in there. So people are taking a certain element of risk doing it. And they take it for the simple reason that it's going to provide a quick fix. Yeah. And there's no such thing as a quick fix.
Yeah. Well, unfortunately, ladies and gentlemen, that's all the time we've had in the show. We've had such a wonderful discussion. Thank you so much for your time. Well, folks, that's all we have for you today. We've had Lynn Mahlangu, Chief Director, Health Promotion, Nutrition and Oral Health from the National Department of Health. Derek Archer, who is owner of FitPro. And of course, Dr. Sindip Bana, endocrinologist and Chief of Endocrinology at Chris Hani Baragwanath Hospital, and also Senior Lecturer at Wits University. Well, thank you so much for your calls, and thank you so much for staying with us. Until next week, same time, well, please do take care.
MedShield, embracing our members in good health since 1968. SMS MedShield to 33023 or talk to your broker to get your kind of care.